First of all, I would like to thank the Joint Apparel Association Forum for organizing this important event. Today, I'm going to give an update on COVID-19 prevention and response at the workplace. I would like to do this presentation taking into consideration the following outline. First, I would be talking about the importance, then certain basic facts, how to prepare the workplace and what response measures you should be taking, and also the monitoring mechanism. Well, if we try to understand the importance, as we all know, we are fighting the third wave of the COVID-19 pandemic currently. Unlike the previous waves, this wave has proven to be more damaging, making the control very challenging. Actually, I have been telling this since the start of this pandemic early in March. According to the available evidence, we need to understand that this will go on for years. Therefore, it is very important that you prepare your workplaces so that there is resilience, and then the business continuity can be ensured. We will very quickly try to understand some of the basic facts about the third wave. In fact, we have observed regarding the transmission of the infection during this wave. Certainly, the transmissibility of the infection has increased, spreading the infection very fast in the country. Vulnerable age groups have changed. Even children and young adults are affected during this wave. Most of them are symptomatic, unlike the previous waves, and significant proportion of them develop complications. Death rates are observed to be higher. Deaths among young patients have been observed. Therefore, there is significant strain on the health system during this wave. And in addition to that, there is speculation about airborne transmission and all. Actually, the number of cases have gone up, especially during the past 2 weeks. We have seen increased number of COVID positive patients in Sri Lanka. Certainly, the transmission of COVID-19 remains the same. We talk about direct transmission, where you can get the infection from infected persons. And this time, of course, since most of the people have symptoms, this method of transmission has become very prominent. And on the other hand, you can get the infection through indirect transmission as well. Incubation period again remains the same. Usually for COVID-19, the incubation period is from 2 to 14 days after exposure. But what we see during this wave is that most of the people, they get symptoms around the 3rd, 4th, 5th day of exposure to a symptomatic COVID-19 positive person. Just to briefly again describe the symptoms. During this wave, we see fever, cough, shortness of breath, and of course, those are the most common symptoms. On the other hand, sore throat, runny nose, headaches, body aches, fatigue, loss of smell and taste, all those things have been reported. Coming to the prevention of COVID-19, I think we need to remember this very, very carefully. The prevention of COVID-19 remains the same. First, we'll talk about the physical distancing. Always we need to maintain physical distancing. And actually, previously we mentioned about this 1 meter. But if you can maintain more than 1 meter, that would be the best, because the transmissibility of this wave is very high. We need to practice hand hygiene. How are we to practice hand hygiene? Always washing our hands with soap and water. Then we need to wear masks. This is very important. We need to wear the mask when we go out of our houses, and also we should not touch our faces with dirty hands. At workplaces, of course, disinfection of frequently touched surfaces becomes very important. Certainly, we should develop mindfulness for us to practice all these things. When it comes to workplaces, what are the goals? COVID-19 free workplace. And sometimes this can be very challenging during these times. If not, what we need to do is, if we find cases, we need to contain it and prevent the spread of infection at the earliest. There are certain rules I would like to describe. Firstly, in workplaces, we have to try and achieve less mixing of employees. We should not let the employees mix. And also, I think we have described previously also regarding this biosecure bubble concept. This we need to apply in workplaces so that we can reduce the number of close contacts as well as the numbers getting infected. Additionally, we should try and achieve work-home social life balance. I would like to describe the preparedness that is necessary at workplaces. There are certain categories of employees you should not bring for work, especially those having symptoms suggestive of COVID-19. If they have fever more than 37 degrees Celsius, or if they complain of COVID-19 suggestive symptoms such as cough, shortness of breath, body aches, even sore throat, you should not get them to work. You should not do it at any cost, because this time we want you all to do this symptom screening and as much as possible to screen and then do the needful. Also, the ones who are undergoing home quarantine, if they are first-line contacts, and additionally, those employees who are living in quarantine mandated households. They might not be first-line contacts, but they might be living in households where there is a first-line contact. As a precautionary method, we would recommend for you not to get them to work. Conducting symptomatic screening of employees on a daily basis very strictly is very important. You should do it at different times and at different places. Firstly, if you can identify the symptomatic employees while at home, that would be the best thing. And then when they get on to the transport, again, you need to do the screening before they enter the workplace. And even at the workplace, if you can screen at least 2 or 3 times, that would be very good. Once you identify these symptomatic employees, you need to direct them to the nearest government hospital, especially district and above, for them to get the necessary testing and further management. Additionally, you need to practice all measures mentioned in the guidelines as per the modified bio-bubble concept. You need to take all possible administrative and physical measures and arrangements for you to keep your workplace free of COVID-19. Hand washing facilities have to be provided. Arrange the workplace to have physical distancing, this time if you can more than 1 meter. Get all the employees to wear well-fitting masks, preferably surgical masks, at all times while at work. Get only the essential number of employees. And especially if you have employees who are doing critical functions, don't let them work all together. Segregate and place them in different places so that if a group is affected, the other groups can continue to work so that there is no disruption of the functionality, disruption of operations in the facility. Well, to talk about the transportation of workers, you need to be very careful because actually we have seen most employees get mixed up as well as they get symptoms or they get infected while being transported. So therefore, always you need to make sure that you transport employees very carefully. Numbers of employees should not exceed the number of seats. All persons in the vehicles should wear masks while traveling. That is very, very essential. Additionally, you need to have records of batches who are being transported. You need to have dedicated vehicles and dedicated seats for these workers as per the biosecure bubble concept. Due to the speculations about airborne transmission, it's always good to keep the shutters open rather than transporting them in air-conditioned situations. Very strict monitoring is essential in terms of transporting your employees. When it comes to the isolation facilities, every workplace needs to identify the isolation facilities. And of course, you need to have the proper personal protective equipment. There has to be somebody trained to take care of the suspected or the positive worker. When it comes to preparedness, again, we should be mindful of super spreaders, super spreading places, and super spreading events. Super spreaders are the ones who will come in contact with several people. In an apparel industry setting, supervisors, even machine mechanics, and those who go from factory to do the maintenance can be super spreaders. So you need to be very careful about them. Symptom screening have to be done for them very strictly. Super spreading places would be the meal rooms and where people get together, especially if you have locker rooms and even lifts. We need to be very careful and then prepare these places so that employees would not get the infection. Super spreading events are the ones where so many people get together, and just to name some of them, parties and in fact even trainings can be super spreading events. Therefore, please don't arrange unnecessary trainings for your staff, but certainly you can use the virtual platforms to do the training. As much as possible, don't arrange these super spreading events. No parties, no trips, no get-togethers during this time. I would like to describe the responsibilities of the management of the enterprises. As we have been telling, all enterprises should develop a COVID-19 preparedness and response plan. This plan should be available at plant level. Of course, there has to be plans at corporate level as well. But each plant should have their own preparedness and response plan. Additionally, we have instructed the management to appoint responsible employees as focal points. And I must thank you because most of you have informed us, the Ministry of Health, the Environmental and Occupational Health Unit, of the details of these focal points, and then we constantly liaise with them to disseminate messages and to get information required. Reorganization of the workplace physically and administratively in order to prepare for COVID-19 is also essential. When you are reorganizing, please be mindful of the vulnerable worker groups, elderly, workers with non-communicable diseases, heart disease, people with pressure, diabetes, kidney disease, liver disease, lung diseases, cancers, autoimmune diseases such as rheumatoid arthritis. You need to be very, very careful. They need to have additional protection. Pregnant employees have to be given special attention, especially in their first trimester and the last trimester. In their first 3 months and last 3 months. Additionally, you need to be careful about the employees who are performing vulnerable work practices, and then you need to target as to how you are going to protect them when developing this plan. Vulnerable work areas too have to be considered in the plan. Monitoring and supervision is something very, very important. We can have everything on pace, but unfortunately, if we don't do monitoring and supervision, we have seen things not happening the way we want. Therefore, it is very essential that you have your in-house monitoring and supervision mechanism. Maybe you can have the CCTV cameras. Certainly, you have to cover all sections. Don't forget about the security staff, the cleaning staff, everyone, and of course, protocol officers if large industries can afford to do so. Continuous awareness creation for employees is very important. You need to update them with the new facts. You need to update them with the gravity of this issue. You need to tell them responsible behavior not only at the workplace, but certainly when going home, and as how they behave even at home is very important to curtail this infection and the transmissibility of COVID-19. Please inform all employees to avoid crowded places and unnecessary travel after work at all times. Ask them not to go to the funeral houses, weddings, all social events like maybe Bana, Dana, all those things, as well as religious activities during this difficult third wave that we are experiencing. I would like to talk about the ventilation of workplaces. Since there is speculation about possible airborne transmission, we need to be very careful with the ventilation. As much as possible, keep the windows open. But I know for apparel industry, most of your plants that is not feasible. Most of the plants are air conditioned. Therefore, you need to be careful and you need to get expert opinion about ventilation from experts in air conditioning for you to design your workplace. And especially what we recommend is you need to have clean air. Maybe the airflow rate has to be increased, as well as the filters need to be of proper caliber. You need to have registers and databases of workers with their names, addresses, contact details, identity card numbers, because this is very important for contact tracing. Well, we will talk about the response measures that needs to be taken. When you identify a suspected COVID-19 employee at your workplace, you need to take certain precautions. You need to isolate that employee and bring him to the isolation room, and that employee needs to continue to wear the face mask. All details about suspected employees need to be taken on a daily basis, and the list has to be submitted to the medical officer of health or the PHI of the area. Suspected employees have to be sent to the nearest government hospital for further testing and management at the earliest. If you identify a positive employee at the workplace, then again you need to inform that to the area medical officer of health or the PHI immediately for further management. If you identify positive employees in your workplace, then you need to identify all close contacts of those positive employees. Close contacts have been defined as people who are within 1 meter proximity, staying for at least 15 minutes, or had direct physical contact with the person who tested positive during the exposure risk period. You need to identify these people from the same section when they have meals together, and also same transportation and same accommodation. There is a revision for the exposure period, which I would like to highlight. Now the exposure period for first line contacts have been revised. If a person is identified having symptoms who became positive, then the exposure period would be 2 days before the person develops symptoms. For asymptomatic patients, 2 days before the date of sample collection for the positive test is the starting point. The end point would be the last day the positive person was at work. You need to identify close contacts during this exposure period, and as per the current guideline, they had to undergo home quarantine. Further, you need to inform about all these things to your area medical officer, and you have to have a very close relationship, a very good rapport with your area medical officer in doing these things. Well, once the first line contacts are removed from the workplace, you can function the facility, function the plant with the second line contacts, but certainly you need to very closely do symptom monitoring among them, and also you need to do random testing, of course, with the guidance of the MOH. And restructuring of the workplace should be done as additional measures. Just to briefly mention about the monitoring mechanism that needs to be followed in enterprises during this outbreak. The focal point is responsible for ensuring health and safety of all employees. He or she should assess the preparedness and response of the enterprise to COVID-19 using the checklist we have given in our guidelines on a daily basis. All focal points have been sent the guidelines, even the revised ones, so you can get the checklist from there. In addition to that, we have developed a Google form. Most of the focal points know about this. So this Google form has to be sent on a daily basis to the Environmental and Occupational Unit. This daily Google form will give information about the number of employees having suspected symptoms during the past 24 hours, number of workers found positive for COVID-19. So such details are there in the Google alert. And I must mention one thing here. Even though we have asked all focal points to send this important alert to us, some do not practice this. It's very important for us to know this so that we know where outbreaks are happening. If you are not sending it, I would rather like everyone to send this Google alert so that we can have a better monitoring system, especially which is critical during this third wave. We have revised the screening and testing strategy. The latest one we did on the 14th of March 2021. There we have very clearly described about screening of symptomatic employees. I would like to stress again the importance of screening symptomatic employees. Therefore, all focal points are advised very strictly to comply with this and to screen symptomatic employees and not to get them to work, but to send them for medical advice and testing at the earliest. If there is an outbreak going on, that means if you identify positive employees in your workplace, with the guidance of the medical officer of health, the testing and of course the quarantine processes will happen. So you need to comply with all those things. In addition to that, if a certain enterprise does not have any positive employees, which means if an enterprise does not have an outbreak, ongoing outbreak, then they can do asymptomatic routine testing as per the revised testing guidelines. It is very important to set up COVID-19 committees within enterprises. This committee should consist of officers from the management and all categories of employees. This is very important for you to understand what is going on and of course for you to continue your operations. So we recommend setting up of COVID-19 committees within enterprises during this third wave. Additionally, you will have to deal with external threats. You might know that sometimes there is a lot of resistance and pressure from the community and maybe local level politicians, retailers. So therefore, you need to deal with such threats also if we are to continue with the operations. Setting up a COVID-19 task force for response within an enterprise is also very important. You will have to do mock drills, practices to see how you will respond when you get an outbreak. You will have to decide on how you would be doing data analysis, identification of positive employees, receiving instructions from health authorities and other authorities, how your communication plan would be, and also the response measures. You will understand that we all have a big responsibility. Management has a huge responsibility. As the employees, all employees should strictly adhere to the measures taken to prevent COVID-19 at workplaces, and it's the responsibility of the management to make aware of all your employees regarding these for them to continue practicing these issues, these measures. Certainly, as the government, we have a responsibility, and that is why we always revise the guidelines. So I would like you to be vigilant. All these guidelines will be posted to the focal points, and also you can download these things from the Ministry of Health website. We need to understand our responsibility. We all have a role to play in this third wave. We need to be accountable, and we are a team. Therefore, we need to unite and work together with the government agencies, especially the Health Ministry, your local area MOH, as well as the Ministry of Health at the national level, Environmental and Occupational Health Unit, so that we can conquer COVID-19 and we can better manage this third wave. Thank you very much.